Okay, welcome everybody. I can see a few people joining now. So, welcome. This is your breakout session. This is the HCPC talking today about equality, diversity, and inclusion, sharing a picture of your profession. We hope that you're going to enjoy the next sort of hour with us. It's going to be really exciting, and we'll talk a little bit about what we're going to cover in a second, if that's all right. But I hope you've enjoyed the rest of the day. I've joined into some of it and really enjoyed it. So, let's go on to a little bit about who we are and what we're presenting today. So you all know about Hello, My Name Is, and I'd just like to mention it every time I do sessions because Dr. Kate Granger had an amazing legacy about Hello, My Name Is, which is fantastic. So my name's Kim Tolley. I'm a professional liaison consultant at the HCPC. So that means that I go out and do sessions for allied healthcare professionals. And I love my job, which is great. So Adrian, over to you.
Thanks, Kim. Hi, so my name is Adrian. I'm Adrian Barrowdale. I am the Strategic Lead for Equality, Diversity, Inclusion at the HCPC. It's a new post for HCPC and a really exciting post as well. So I'm really pleased to be here. I am 2 months old in HCPC and I'm really pleased to be here. So thank you very much.
Yeah, that's great. So that's who we are. And we wanted to start, both Adrian and I wanted to start really. I know that you've probably been told this before, but you can't be told it enough. A big thank you from all of us at the HCPC for everything you're doing, particularly at the moment in the pandemic. It's been absolutely amazing. And I think we want to just say a huge thank you to all of you for everything you've done. So big thank you to you all. Anyway, this is what we're going to cover today. We're going to look a little bit about our role and our commitment in equality and diversity and inclusion. We're going to look at some of the progress we've made under the ED&I statistics that we can share with you. And we're going to share some of the really new data. It's not actually published at the moment. It's about to be published on our website, but we thought we'd share you and give you a little picture of some of the ED&I data that we hold, just for your interest really, and just for you to also be able to ask us questions. Now, we have an hour's presentation, but we don't have the full hour in our presentation. What we'd like to do is have a very interactive session with questions and answers. So we will be pausing, just have a little bit of a look in the chat. And both Adrian and I are really happy to answer any questions you've got or any questions that come up from the presentation that we're going to be doing. So we'll be stopping and starting as we go to ask questions in chat. And I'll also be posting some links in chat as well for some important key things that we'd like to ask you to do, if that's okay. So we hope that you find it as interesting as it can be remotely, and we would love to be in person. We were just talking to Rachel about where we will be in the future, but she hopes that it might be in Cardiff next year. So wouldn't that be wonderful? So that's a little bit about what we're going to cover today. We wanted to start with a little bit, very briefly, about our role at the HCPC. We are one of the regulators, as you know. We regulate 15 professions, and those professions will all be represented by you in the room today. We're very similar to the General Medical Council, who regulate doctors, and the NMC, who regulate nurses. We maintain the register of you, so you're all on the register of the HCPC. I think one of the things we do that's really, really important is we write and embed the standards. And my role is very much about embedding those standards. The clever people in our policy and standards team write the standards and guidance that you have to, and I also have to abide by as a registrant because I'm a nurse by profession. They write them, and my job is to go out and talk about them and just promote them, particularly amongst students, actually, because that's really nice to talk about them during their pre-registration training. But they're really good. The standards of proficiency are about to be published, hopefully the beginning of next year. And we have a rolling programme of our standards being updated. The standards of conduct, performance and ethics are going to be reviewed next year as well. We also quality assure the schools, so we quality assure universities where you train, and also part of our function is fitness to practice. That's our statutory obligation, and it's very much part of public protection. So our primary role is public protection, and that's actually what we do. A little bit of a recap about our standards and guidance. You can see them there. So if any students are on the call, those are your standards of guidance on the left hand side, and on the right hand side are the standards of conduct, performance and ethics, and also the standard of proficiency and the standards of CPD, which you all have to abide by, and they're very much there for you. And we have a really good website with lots of interactive material about our standards and guidance for you. So I'm going to pause for any questions. No questions coming through at the moment. That slide is to remind me to pause for questions, because sometimes you know what it's like when you're presenting. You carry on regardless. No questions coming up at the moment. And I'm going to pass to Adrian, who's going to talk about our vision and values.
Lovely.
Adrian.
Thank you. Thanks, Kim. And yeah, please do keep questions coming in even as we're talking. I'd rather stop and pick up anything that that springs to mind for you, anyone who's listening, and anything that sparks an interest, please do just let us know. So I'm not going to talk you through HCPC's corporate strategy and the depth of our visions and values. What I really want to say is that equality and diversity doesn't exist in a vacuum. Our intention is to make sure that it's part of our core business. And as you can see from our overarching vision, we want to be a caring regulator that works through strong evidence-based regulation, but which is inclusive and fair. And really that gets to the heart of why we do our equality and diversity inclusion work. And it kind of sets out our approach, really. So that's our overarching ambition as HCPC. What I'll do now is to kind of say a little bit more about our EDI strategy and how that sits underneath our corporate strategy. So Kim, could you
there we go.
Thank you very much. So we've recently published, I think it was in March, our equality, diversity, inclusion strategy, and that sets out our overarching vision, which is to be an actively anti-discriminatory organisation. I think that's a really important starting point. We're not content to sit back and ensure that we don't discriminate. We have a determination to make sure that we challenge existing discrimination and inequality. So this is about us being active interventionist, really, looking at things like education and training experiences. What role can we play in improving those and ensuring that they are fair and eliminating any existing inequalities that might exist? And we want to be able to do that confidently. We want to be one of the voices really active in this kind of agenda. So that's why we have our strategy, and our strategy touches on a number of things. We say things like we are determined to, excuse me, we want to exceed our legal obligations. So we're not content to sit back and do the legal minimum. We're determined to be doing more than that. We're going to be data driven, and that's really what we're going to talk about a little bit later on today. But we set ambitions that our decision making is going to be fair. But in order to do that, we need to know what it is that tells us decision making is fair, and we'll cover some of that later on today. So our equality, diversity, inclusion strategy sets out what we're going to do, and it also contains really an explanation of what it will look like in 5 years' time if we've been successful in delivering that over the next 6 months. And some of you may well hear from me while we do this. We'll be developing the action plan that will set out exactly how we're going to achieve our vision, how we're going to deliver it, the kind of things that you'll be hearing from us, the kind of things that we want to do, but also we need to make sure it's being led and it has credibility, that registrants, public, patients have a real say in what it is that we do and how we're going to prioritise our work. So all being well, you'll be hearing from us in the coming months on that. Kim, if you wouldn't mind, thank you. Now, you may well have heard from us over the last 2 years asking you to share with us information. And it would have been Equality, Diversity, Inclusion survey that we've held. So we've held 2 of these surveys. And they've been standalone exercises. And I think that's probably an important thing to say at this point, is that HCPC is on the cusp of really integrating this in the way that we do our business. Up until this point, we've had to run these as standalone exercises where we've written to every registrant and given them the voluntary, and it is important to say, that voluntary opportunity to share with us information that would include ethnicity, religion, sexual orientation, but also some additional factors. So things like where you work, the locations that you work, the kind of practice settings that you have, maybe educational background as well. And all of this really helps us build a picture. Caring responsibilities also feature it. It really helps us build a picture of who it is that makes up the register. Where do our professions come from? And that really allows us, and that's very much a starting point with our survey, and I'll come on to how we've moved on in a little bit, but that really helps us understand the issues that impact on our registrants, and it gives us a starting point to start thinking about what that means for workforce planning and the like. In a second, Kim and I are going to talk you through some of the findings of our most recent survey, which concluded in March 2021. The surveys themselves can be found on the website, so you can go and have a look at these in detail and depth, and there's a huge amount of really interesting information in there. We had 57,000 registrants respond to our last survey, which is fantastic. That's a massive increase over our first survey, where only 5.9% of the register completed. It was 18% this time round, which is a dramatic improvement. We're really pleased with that. We know we can do more, and we'll talk a little bit more about how we're going to do more in a little bit. Next slide, please, Kim. So in fact, I've just covered that. So what we'll do is what we'll do now is we'll just talk you through, and this is, I guess, the substance of this session is just some of the key facts that we've seen from looking at the data that you provided us. There's some pieces of interest there. There's some reflection, and we'd be really keen to understand what it is. Does this look like you'd expect it to look? Are there any surprises along the way? So as Kim walks you through this slide, have those questions in mind. I'm going to come back and talk through another couple of slides after that, and then we'll kind of talk about what the future looks like.
Yeah, so Adrian, so we thought we just picked a couple of professional groups, didn't we, Adrian? We've got actually a fact sheet about to be launched, like on our website, which has a fact sheet for every professional group, which is really exciting, and it gives us some really interesting statistics, really. And like Adrian said, about 18% of people answer the questions. So here we've got a little bit about ethnicity of radiographers, and as I said, it's different for each professional group, which is quite interesting. So you can see that 70% of radiographers are white ethnicity, and you can see the other groups there as well. I just think this is really interesting for things like workforce planning, thinking about integrating new starters in with, if you're a new starter, what sort of cultural issues have you got? I'm very committed, and I'll talk about in a bit, to a session we call Joining the UK Workforce, where we're doing a session for new registrants who join the register, and that this sort of data really drives some of the work we're doing. And I think that's the important thing, is the HCPC has got a sort of unique opportunity to let it to now we've got the information to drive some of the changes within us that are useful for you as registrants, because we want to use this information and use it intelligently to drive some of the things that we actually do as a regulator. So this is just a sort of glimpse of some of the things we've got, really. So we chose physiotherapists just because we did. And you can see there, this is work settings for physiotherapists, and you can see there some really interesting data and key findings there of the proportion. Sorry, I've lost my train of thought there. Sorry, I'm just going back to my current slide, so I couldn't quite see it. So you can see there that the physiotherapists, a large proportion, which you get from being in healthcare, a large 41% actually work in the NHS or acute hospitals. But we can see that actually 20% work in the independent or private sector, and 16% work in the community. So again, this is really interesting, particularly for things like developing education for physiotherapists. So if you're an education somebody who's running pre-registration undergraduate programs for physiotherapists, this gives you some information so that you know that actually sort of 4 out of 10 of your physiotherapists who are going to start working are going to go and work in the NHS sector, but actually quite 15% of them are going to go and work in the community. So that will drive some of the changes that you make to your educational programs. So you might think, actually, we need to include a little bit more about community settings and working as a physiotherapist, or even we need to include more about how you work as a physiotherapist within the independent sector. So you can see how this information gives us really important data, really. And I think that's what we're hoping, that it'll be picked up by employers, by universities, and actually used to drive some changes for them. So we thought we'd show you a little bit about speech and language therapists. This is quite interesting because compared to other professions, 76% are female. Actually, Adrian, this is your slide, isn't it, Adrian? So my apologies, I've jumped onto your slide, so I do apologise for that, and I haven't moved on in the main bit, so I do apologise for that.
No problem at all.
So here we go, Adrian.
So yes, so thank you. So exactly as Kim says, now this might not be an enormous surprise. Speech and language therapists are overwhelmingly a female-dominated profession. And we can contrast that, as Kim said, with the register, which is 76% female. But why do we care? Why is this interesting for us? So one of the things that's really important for us to understand is when we overlay this with the way in which we interact with the professions. So thinking about the one that, unfortunately does live large in a lot of registrants' minds, fitness to practice, for example, is there any overrepresentation of one gender or another in our fitness to practice processes? it's really important to be able to overlay that with what the profession looks like in the first place. So are there particular risky professions in terms of fitness to practice? Are there more professions who are likely to be referred into fitness to practice? When we can start looking at that data, we can do some of the work that Kim's already mentioned there about our intervention work that we think is really important to prevent people from falling into a fitness to practice process in the first place. It allows us to be a lot more targeted, and we can be a lot more curious about what it might be that's driving some of those differences. So to contrast this with the next slide, if you wouldn't mind, Kim, please. With paramedics, for example, which is certainly compared to the register, an enormous outlier. 59% of paramedics men, in a register that's 76% female. That is a huge difference. And that also has implications for the way in which those services will continue to run in the future as well. Again, as Kim talked about there, workforce planning, and our ability then to understand who it is that's leaving the register, or why they're leaving the register, and will that have a particular impact on particular professions. So when we start collecting this data, it allows us at HCPC to make sure that we're answering that core question that we will talk right back at the beginning, our ambition to be a fair regulator. It's all well and good having that ambition. It's very difficult to be confident we are a fair regulator unless we know who our processes are impacting on and in what way they're impacting on them. And when we're compassionate, well, our wider ambition to be a compassionate regulator that understands the pressures that might exist on people outside of their working lives as well. If we can move on to the next slide, please, Kim. We talk about caring responsibilities here. 35% of respondents said that they have caring responsibilities. But that does differ, but not enormously across professions, actually. It's a reasonably straightforward mix across our professions about those with responsibilities and those who have no caring responsibilities. But each of those professions is probably better or more or less able to respond to the consequences of those caring responsibilities. So I'm incredibly fortunate. I have caring responsibilities. I work in an office-based role. That makes it much more easy for me to access maybe the support that I need to. If you're a single practitioner working in a private practice, or if you're working in a degree of isolation, it's much more difficult to respond to those caring responsibilities and for those to be factored into your daily working lives. So again, thinking about the way in which we prepare people for their professions through the education and training that we regulate, understanding this is fundamental to making sure that we are properly equipping our registrants with the skills, the tools, the knowledge, and the understanding of what their careers are going to be like. Can they meet the health needs that we're asking them to? These are just snapshots. We've got fact sheets for each of the professions that will be available, and they should be available by Monday. You'll be able to go straight to our website and find them there. And we also have one overarching fact sheet which also sets out what the overall picture of the register looks like, and then you can compare individual professions with that overall picture of the register. It's important to say, it's only 18% of the register has responded to this. So we've called this a snapshot of the profession, playing back to you what our understanding of other professions are right now. We are conscious that even within there may well be some professions who are less likely than others to have responded to that survey, perhaps just purely as a consequence of time pressures, working in highly pressurized working environments like all of our professions do. Some of those might have prevented people from being able to complete the survey in the first place. So there will be some professions that we understand less well than others. And that's given us a real kind of kick to the future, if you like, about what we're going to do in the future. I'm just going to pause at this point and just make sure I'm just going to check back into the chat and make sure there's no questions that we've missed as yet.
I don't think so, Adrian. That's it. That's good.
Okay. No problem at all. Okay, fantastic. Thank you very much. And by the way, if the questions can be as straightforward or as specific as you like. I can't guarantee that we'll be able to answer them right now, but we'll certainly have a go if there are any. If there's any particular concerns around this wider, what this means for our equality and diversity inclusion ambitions, please just fire away. So we've just tried to capture here is some of the information we've collected. So, and why we've done it, I think is probably an important thing to do. So, we talk about age and what it means. It is an aging workforce in the UK. It's an aging population in the UK. What does that mean for the way in which we're going to do our workforce planning? How can we support the development of those professions? And how that interacts with disability. So 80% of disabled people will acquire that disability at some point in their working lives. They may even acquire it as a consequence of their working lives. So we really want to understand certainly what the picture of disability looks like now, but also how that changes over time. And that's why getting that benchmark for our understanding professions in as early as we possibly can is really important for us when we think about how we want to develop and improve as a regulator. We've already covered care and responsibilities. Ethnicity and religion are really important, particularly when we look at ethnicity and some really established problems and issues that exist in other professions. So I've come from a number of years at the General Medical Council there. And when I was in my time at the General Medical Council, we dealt an awful lot with the problems of differential attainment, so specifically an ethnic attainment gap. So a long-standing substantive problem that was reflected in a gap in the overall achievement scores between white UK educated doctors and BAME educated UK educated doctors. What did that say about the quality of educational experience different groups had, bearing in mind they'd all had the same educational experience, which as the regulator we were responsible for? At the moment, without this information, HCPC has been poorly equipped, I think it's fair to say, to understand that. And to really get to grips with and some of those really personal experiences as well, issues of the things that we are perhaps less well sighted on at the moment. I don't think it's possible at the moment for us to have a proper grasp of things like the risk of sexual harassment in the workplace, and making sure that that's not entirely left to an employer's responsibility, but that, again, as the regulator of those professions, who will also be regulating education and trainings, often in workplace settings, making sure that training environments are approved by us. How are we assuring ourselves that people are being protected from issues like that? So there's some really contentious, really tricky questions that we can't answer without collecting this kind of information. Which is why, if I could just move on to this slide, Kim, please. This is probably the biggest change that we've achieved, or will have hoped to have achieved in the last few years. Our biggest plan for the future. So as of Monday, the 1st of December, we are launching our registrant EDI portal. At the moment, it's being linked to our renewal cycle. So anyone who has to renew their registration will be given the opportunity to complete an EDI portal form. So this is, as part of your online account, you'll be able to go on and you'll be able to, all the information that we've collected through a distinct separate survey previously, you'll now be able to share directly with HCPC. This is information that only our data analysts will have access to. So first of all, it will not be published publicly on any publicly available record, but more importantly, it also won't be visible to any of our fitness to practice teams or our registration teams. It's information that lives entirely separately, but it will allow us, as soon as we get sufficient data quality, it will allow us to answer some of those more detailed questions that we've just walked through a second ago. At the moment, 18% of the registered have been kind enough to share that information with us. Our hope is that when we have access to a portal that is you as registrants will be able to access directly, you'll be able to give us up-to-date, accurate information at any time of your choosing. You'll also see the point of doing it, because we'll be able to share these fact sheets, for example. We'll be able to circulate that with you. We'll also find ourselves at the end of that 2-year cycle. I mean, we're going to use the data immediately. We're not going to wait for 2 years. Our EDI strategy says very much that we want to start addressing this now. Data is just a starting point for checking some of we don't need data to get started on this, but it's I would describe it as probably the foundation stone of our future EDI work. So, I mean, before I hand over to Kim, what I would say is please do when you get the opportunity, when you get that inclusion email, renewal email, please do take the opportunity to complete that form. Please do share as much information you're comfortable with. It always includes a prefer not to say option as well. We think that's always important, and that gets counted as a valid response, and we think that's really important because that alone tells us something about how registrants feel about us, about trust in the regulator. This is a really important part of it, and being trusted to look after that data is something that is essential for the success of this. So if people do prefer not to say, and that will always remain someone's right to prefer not to say, then we think that it's important to work over time to drive down that percentage of people who feel that they at the current time prefer not to say. I threatened Kim there by saying I was going to hand over to her, but actually I've got one more slide to go.
There you go, Adrian.
Thank you very much. So linked to all of this is the existence of our EDI forum. So our EDI forum is a mechanism currently online, as you might be surprised to hear, of interested people. And I think that's about as far as I would really want to describe it. It's people who have an interest in equality, diversity, and inclusion, who want to contribute to the HCPC's development in this area. So far it's met 3 times in 2021. I've met the forum now once. It happened just after my first day, it's such a brilliant discussion forum. It's where we're able to bring information, we're able to bring policies, procedures, we're able to discuss how HCPC should respond to government consultations, for example. And I would really encourage you that if anything you've heard today is something you'd like to know more about, or if there's something in particular that you think the HCPC should be addressing that we're not, the EDI forum is a really good place to get involved, to start those discussions. And I really can't stress this enough, you will have the direct opportunity to influence the way in which we take this work forward. So just to run you through some things we've done before. So they're instrumental in looking at the joining the UK workforce programme, which Kim's going to talk about in a second. We've looked at review of return to practice. So what requirements do we put on people who are returning to practice? How easy is it for people to meet those requirements? Is it making sure there's nothing that is inadvertently discriminatory? And again, being our voice, our ears of the profession, and that constructive challenge, it's such an important part of getting any of this work right. It's impossible to deliver this in isolation. It's all very well I can go and shut a door in this room that I'm sat in right now and develop a strategy, but it's largely meaningless if it doesn't have validity and credibility with the professions. I've just seen a question come in from Clive there. Do you have any data on gender and ethnicity and progression to more senior positions? At the moment, I think HCPC doesn't have access to the information, but you won't be surprised to hear me say that when we've got completion information through our registrant portal, we'll be able to start looking at the kind of data that exists within workforce settings as well, workplace settings. And when you say it's not necessarily a registration issue, you may well be right. It may not be a registration issue, but I think it does often. So this is speaking from personal experience at the GMC. The patterns we saw, for example, about how doctors progress through to consultant positions and their ability, even when they've been awarded their certificate of completion of training, which entitles them to go to consultant positions, the ability or the success rate of people transferring that into obtaining a consultant position quite often mirrored some of the gaps that we saw in their training and education experiences, which is the bit that GMC was directly responsible for. Access to that data right now, I don't think we do have that, but I think it's the kind of thing that we'll is exactly why we're here to discuss it right now, because it says an awful lot as well about how well those professions safeguard the careers of specific individuals and groups of people within those professions. So I think it's absolutely the right question to be asking. What I would say is come and ask me in 2 years' time when we've got more access to it. Thank you, Clive. And yeah, and then you can see some of the other stuff on there. So our gender ethnicity pay gap reports, and I think that's an important part because that's about our operation and our performance as a regulator as well. So we have a very small gender pay gap, which we're proud of. There is an ethnic pay gap, which is something that we're very keen to address. So again, looking at our own conduct as an employer, we couldn't convincingly stand in front of anyone and talk about our ambitions for the professions we regulate without getting our own house in order. So that's why we think it's important that we bring that kind of information to something like the EDI forum, where people can ask us questions, ask us about what we're doing. So that has helped us do some internal work. For example, we're running an internal mentoring scheme, which is in the process of running right now. In fact, we're just people have an interest and want to be mentored. I've applied to be a mentor. So for people who would like mentees who would like experience and exposure to more senior positions within their organisation, who have a specific knowledge or skills or even confidence gap that they would like closing through that experience, is something that we've talked about again at the EDI forum, because it does a specific EDI focus. So hopefully there's something there. For you. I think I can now, in fact, hand over to Kim.
Thanks, Adrian. So we wanted to just share with you an initiative that we've started, that we actually ran through the ED&I forum to see if they agreed with it and see if they felt that we were doing the right thing. Like Adrian, I came from the General Medical Council, and the GMC was quite lucky. It does have a lot of data on its registrants. And one of the things that we started at the General Medical Council was a project called Welcome to UK Practice, because it became clear from our data that doctors who came from overseas were more likely to get into our fitness to practice proceedings than doctors who were UK trained. And that was it was a very hard message to hear at the GMC. It was a very difficult message because often I was involved in developing the Welcome to UK Practice program, and we've since delivered that half-day program to thousands and thousands of doctors. They're invited to come on a Welcome to UK Practice program when they get their registration, their approval for registration. And one of the things we feel it's really important to do is to share that information with the profession, because there's no good me standing up there and saying we're doing the Welcome to UK Practice because we just are. We're doing it because, as a regulator, the GMC, we knew that there was a higher instance of getting to fitness to practice. So it was important to share that information and then to say, but this is the information that I think will help you, because we know that doctors, from our data at the GMC, that doctors don't get into issues about clinical incidents. What they get into issues with the GMC about is professionalism issues, about trust and honesty and probity issues. So when I joined the HCPC about a year ago, one of the things I wanted to bring with me was, as Adrian said, we don't have this data. We don't know that more HCPC registrants who train from abroad are more likely to get into a fitness practice proceedings. We don't know that. But I just felt that I wanted to use that information I had at the GMC to benefit other professions. So we started a program called Joining the UK Workforce, which is a 2.5-hour session, which we've now piloted with about 8 groups. We've done them profession specific. So we've worked with Health Education England, because those 4 groups, paramedics, occupational therapists, radiographers and physiotherapists, are the groups of professionals that they want to recruit more from overseas, that they have government targets to recruit more from overseas. So we worked with them. We invited professionals who had joined the register over the last 6 months, and they came along to our I called it Welcome to Your Practice, our Joining the UK Workforce sessions. We ran a couple of focus groups along with the ED&I forum. Actually, we talked to them about it. We ran a couple of focus groups with registrants, and we asked them what they would like. And they said they'd like us to cover the HCPC role, lots of everyday ethical dilemmas, and about working in the NHS. So we've designed this program for them. It's co-delivered now by Health Education England and the professional bodies, because one of the things they didn't also said was they didn't know when they came to the UK what a professional body was. So professional bodies play a massive part. I'm sure that you know that in your job and the support that you have in your roles, and they didn't know about them. So it's important to work with the professional bodies. So we work with the College of Paramedics, for example, and the Royal College of Radiographers to deliver the session. And some of our ED&I forum colleagues actually offered their own selves to us. And the lady there is Doreen. Doreen was kind enough. If Doreen is on the call, I'm going to be so chuffed. But anyway, Doreen came along and offered herself, and I interviewed Doreen about her experiences of being a new registrant to the UK, and she talked about those experiences. And we use those videos in our sessions because there's nothing better. Doreen can't come to every session because she's working as a physiotherapist and she's busy. So, but she can, in a video, be shown to every person we have come through, every new registrant we come through, to talk about her experiences of being a new registrant. So, that's what we're doing. We've started thinking about what our data might show us, although we don't definitely know what it does show us yet. But that's a new initiative that we started through the ED&I forum. So we wanted to, Adrian and I, share a couple of few resources that we thought you might find useful to you. We'd like to ask you in the chat, firstly, what you'd like to hear more about from the HCPC, and what more should the HCPC be doing to develop its ED&I agenda? We've already had a couple of things, and thank you very much to Clive for mentioning that, because actually that really helps Adrian. He can then take that forward, and especially if you join the ED&I forum, which we would love you to. Same for you, Paul, we'd love you to join, because then actually you can influence what we do. So if you want to put in chat anything you feel that we can improve or that we can develop on, that would be super useful. I'd like to just signpost while I'm on the call to our COVID pages, which are really useful, our COVID hub, and also to our wellbeing resources, which are available on our website if you'd like to catch them. We've got some really good resources there. And also our student hub. So if there's any students on the call, if they'd like to use our student hub. Now, our student hub is fairly new. It's only been sort of launched a couple of months ago. And what we'd like you to do also when you look at the student hub is to tell us what you think about it. I've put the little link up for you as well. We have an employer newsletter. Now, this is really important. It has an ED&I focus. The last employer newsletter was about ED&I, interestingly. It has a special focus on ED&I. But we would love you, if you are an employer, if you want to join, sign up for our employer newsletter. I'm putting the link on chat. Just drop your email in. You'll get a newsletter 4 times a year. I think it might be 3 times a year. And the next one, interestingly, is on fitness to practice. So a really sort of hot topic. I know something that all health professionals are very worried about and concerned about. On our next one that's only published in a couple of weeks, will be about that. So do sign up for that if you can. That's how you get in touch with us, but Adrian and I will share our emails at the end. And also, a big thing that's happening at the moment is the HCPC stakeholder survey. So we want to find at the HCPC what you think of us. Okay, so it's all right us thinking what you think of us, but we want to know what you think of us. So we have been asking all of our registrants to complete our perception survey. And again, I'm going to drop that little perception survey in the chat, because it would be lovely. It closes in about 5 days' time, but it would be absolutely wonderful if you've got time and I can see there's a question coming, so I will stop in a minute. If you've got time to complete that, we would absolutely love it. I'm going to hold that slide on the screen because I think there's a question. Clive has said, I would like to understand the use of apprenticeships as part of routes to registration to improve access for some communities. Yeah, Clive, if you want to email me, I can certainly put you in touch with somebody at Health Education England. I don't know anything about apprenticeships, and I don't know if Adrian does either. Do you know anything, Adrian?
I don't, I'm afraid, no.
But I can certainly put you in touch with somebody at Health Education England who will know, and they can sort of give you some support. Health Education England have kindly started a new programme. They run the Return to Practice programme already, but as part of the Joining the UK Workforce sort of initiative, they've started a new programme for overseas registrants who want to join the who are on the register but want to get some experience in the NHS, because one of the barriers that they have is that they struggle to get experience in the NHS. So Health Education England are working with them to get them that experience, because once you're at disadvantage coming from overseas if you're applying for jobs and you don't have any experience in the NHS. So one of the things, the barriers for them, because we all know there's a shortage of allied health professionals. So one of the barriers to them getting jobs is that. So it's a real sticking point. So Health Education England are working really hard to try and sort of reduce some of those barriers and work on some of those barriers. And through their return to practice program that they've adapted for international registrants, they're working on that. So certainly I can point you in the right direction. And I'm going to pause for questions if there's anything else coming up at the moment. I don't think there is. We wanted to end our slide with a big thank you, as usual. A thank you at the start and a thank you for everything that you're doing for health and social care at the moment. And we will pause for a second to see if there's any questions. Amanda said, recruitment for overseas can be problematic. We're picking that up in our Joining the UK Workforce sessions. The registrants are able to talk about their difficulties getting jobs. And it's quite sad when you hear that they really want to come and work in the UK, and some of the difficulties that they're having to try and get through. One of the registrants I was talking the other day about application forms. He wasn't used to doing an NHS application form. How would he? And even writing some of the terminology. And again, Health Education England and also the colleges are coming up trumps really with trying to support them to get them to get a job, because as I said, it's a really important thing, and we don't want to disadvantage them in the employment market. But again, the information that Adrian is collecting as part of the ED&I survey when we renew our registrations, I already as a nurse already complete that every year when I revalidate, will give us so much more information on this and enable us to look at some of the issues about recruitment from overseas. Because if we have a big pool of registrants who are with us but don't have jobs and came from overseas, that clearly shows us again that there's a massive need to support those registrants, and we can then drive that support. So it's really important.
Yeah. Thank you, Kim. And also just want to say that we're also launching a review of our overseas registration process as well in the new year. So again, as a selling point for the EDI forum, there should be a real opportunity there to look into what our process for registration of overseas registrants is, what issues it causes, how we can improve that, how we can make sure that people are able to access registration in the way that they should do, that our standards are being maintained in the way that we run that registration process as well. So yeah, we're really keen to make sure that overseas registration process is sensible, it's smooth, and it's appropriate.
Fair. Yeah.
Absolutely. Thank you. I will have, if there's, I do have one more illustration of a point that the EDI forum we'd like them to be involved in the coming years, and it's I've left it till the end because normally it's a question. Normally it's a question if I'm honest, which is around disproportionality in practice processes. So it is a real concern for us and for registrants, absolutely. The problem is that we don't know. The problem is that at the moment, we're unable to say whether or not our fitness to practice processes disproportionately impact on any specific group anywhere, and that's a consequence of us not having limited access to data, but it's also a consequence of us not really having the capability previously to really engage this data in the way that we like. We've actually recently appointed a new head of data and insight, Dr. Gareth Davies, who's joined us, who's going to provide an absolutely fundamental role in helping us really unpick some of these difficulties. And the reason I want to leave this till last is because disproportionality in fitness to practice is a worrying phenomenon outside of HCPC land. It's something that exists in pretty much every regulator to some way, shape, or form. Not necessarily even in a healthcare setting. Certainly solicitors, lawyers have seen similar issues. I believe similar issues exist within architecture even. So there are a number of worlds in which disproportionality for regulators exists. The difficulty always comes from unpicking those, and this is where the EDI forum will come in a really come into its own and really play a huge part. When we look at what drives disproportionality, the questions we get, so this is based on my experience at GMC, the GMC had disproportionate numbers of BME doctors within its fitness of practice processes. It took a long time to unpick exactly what was going on there. And fundamentally, after a lot of questioning and a lot of data analysis, it became clear that the driver for that was that employers are more likely to refer BME doctors than white doctors to the regulator. That in itself is a massive concern, and that is some of the work that we'd look at. How could we address that if we were to see similar patterns at HCPC? What could we do? What work could we do with employers and in workplace settings to address some of that? But also, it asks, what is the question that's going on there? What is the driver of that? Is it employers who are more likely to want to punish BME doctors by sending them to the regulator? Or, as we soon started to unpick, was it an employer nervous about being accused of treating a BME or overseas doctor differently to a UK white doctor, was more likely to want to play straight by the book and send them straight to the regulator for an instant that, had it been a white doctor, they might have been more likely to have a quiet word or even a screaming match in a boardroom somewhere to address the particular episode of misconduct that might have otherwise warranted a referral? Or, looking again at a different level, the structures that prevent people from falling into a fitness practice processes, the supportive, collaborative working environments that allow people to develop, are they less accessible for BME doctors or doctors who graduated overseas than they are for UK trained white doctors? All of those questions are really complex. They really overlap. And it's when we have access to that data in HCPC that we can look into the experiences of our registrants and really seek to understand what patterns we have, and then what the drivers of those patterns are. So
I think Adrian, I was just going to say that the really interesting thing was that data is now translated into the Welcome to UK Practice Programme at the GMC, which is what we're thinking of doing, something similar with the HCPC. And because the data can even be cut at the GMC about even the types of allegations, it gives us real data about what are the things. And one of the things was a very simple thing, which was chaperoning. So simple, but lots of the complaints that come into the GMC are about inappropriate relationships with patients. And what that showed us was, and what we became clear was, that European doctors, interestingly, don't have chaperones. It's just not something that's done in Europe. It's just not a thing. And so it was really important to talk to doctors who come from overseas, to talk to them about that, because if you're not used to that, and the chaperone is obviously there for the patient and there for the doctor, then how would you do that? You wouldn't, because you wouldn't know, you wouldn't do it. So it's simple things like that that really drove the changes that we can then, as a regulator, talk to our registrants about. And I think that's what you're saying, Adrian, isn't it? Those things we're really trust and honesty and probity, for example, was a big issue. Social media, so we can talk about those things and be more open about them.
Yeah, absolutely. And I guess the reason that's a selling point is for the EDI forum and for people who are interested in joining that, is because I think we acknowledge at HCPC that we are at the beginning, and we're very much more at the beginning than that maybe some of the regulars might be of that journey. So it's kind of an opportunity to get in at the ground floor, really, and kind of really help us get to grips with something that we're really excited about doing, and that's why we have this 5-year strategy. That's why it is so ambitious. So I've committed ourselves to answering that question of, are we a fair regulator? Do we conduct our regulation fairly? So if anything that we've just said over the last 50 minutes or so has been interesting, and you think that that's something you'd like to get involved with, you have both of mine and Kim's email addresses in the chat bar, and you've have access to the presentation materials as well after this session. So please do get in touch.
Yeah, we'd absolutely love you too. We'd really value your contributions, which is fun. And you'd be able to drive the changes, which is always an opportunity, isn't it? That's certainly what's attracted both Adrian and I to come and be part of the HCPC's journey, really, because it's going to be a really interesting journey, isn't it?
Yeah, absolutely. Yeah.
Okay, well, we're probably going to finish a few minutes early, which is always a gift, isn't it, really, in a presentation? So we finished just under 10 minutes early. So do go and have a lovely break, make a cup of tea or etc., and enjoy the rest of your conference. And do contact us if you want to. We'd really love to hear from you. I think that Rachel is here, and she might come back and just say, we're going to go, or we will just go. You take care anyway, everybody. Thanks.
Thank you very much.
Thanks. Take care. Bye-bye.